I'm going to teach you a magic trick with a tennis ball. You're going to transform your back spasms, your trigger points, into functional, happy, healthy, cooperative muscles. And you're going to do it all with a tennis ball. So the four most common muscles to give you problems in the back are the longissimus, the iliocostalis lumborum, the quadratus lumborum, and the glute medius. I'm going to throw in some piriformis in there too for you moms with nerve or leg pain. So the placement of the ball, as shown in these videos, is going to be the most important thing. You want to find your most sore spot. This first one is going to be high up on the back. You're going to put some weight on the ball. The ball is off to the side of the spine, not over the bony prominences, but in the soft spots. You'll feel your ribs kind of pressing into the ball a little bit, and that's okay. And you're going to come on and off. Play around with the ball. Make sure it's in the most sensitive area that feels like it's doing you the most good. None of these should feel like salt in the wound or should feel like it's going to ruin your day or that it's making things worse. This should feel relieving. There may be a couple of loosey-gooseys out there that just don't do well with this technique. Give it a try. If it's not for you, we'll find something else that works for you. Now I'm down in the lowest part here in the quadratus lumborum. When you get down that low, the rolling on and off technique doesn't work as well. So try this one here where you bring your knee up towards your chest. It's going to feel amazing. The nature of a trigger point is that sometimes you'll start to feel that pain somewhere else, maybe down into the leg or into the glute or up the back. That's normal and that's actually desirable because that means you're on an actual trigger point. Here I am in the gluteus medius. And you can see that it's just below the belt line, above the back pocket, rolling on and rolling off. I'm moving quickly here in the video, but you'll spend anywhere from 2 to 3 minutes in any one spot, rolling on and off. Play around with the ball placement. Like I said, they're big muscles, and just a little movement of the ball can make a big difference. The ball should stay still and your body should move. You shouldn't try to roll your body around on the ball. It should be an on and off technique. Here's a little variation here with the leg crossed. You can see by the look on my face I'm really getting into that spot. And just to review, tennis ball up high in the back, in the lower parts of maybe the last couple of ribs. Put some weight on it. Try bringing a knee towards your chest. Try rolling on and off. Enjoy the pressure. The pressure is going to get rid of those trigger points, transform the muscle into a healthy cooperative tissue. This is a review of the gluteus medius, just right above your back pocket, below your belt line. Roll on. Here's a couple of things to remember. We don't want you looking like you're like twerking with this thing here, okay? You don't need to be moving your body all around like this. This is the wrong way. Okay, this is what not to do. You're going to place the ball in one specific location and use your body to put pressure on and take pressure off. And this might happen with just breathing as I'm demonstrating here. Just breathing can sometimes add the pressure that you need. Sometimes you want to bring a knee towards your chest, and other times you want to just roll your legs side to side. But you're doing a great job if it's in a sore spot that feels like it's doing you some good. Okay, here's the review of the placement for the ball. Up a few inches above the hip into the low back. You're going to feel some ribs up in this point, okay? You're in the upper lumbar, lower thoracic spine. You feel a few ribs. That's all right. Enjoy the pressure up there. Then drop the ball down a little bit lower, right above the hip, into the soft spot. Keep it off of the bone, and keep the ball off of the spine, just right off to the side of the spine. This is a 2-for-1. You're going to get iliocostalis and quadratus lumborum in this spot. Here is the gluteus medius spot. This is a wide muscle, so you might put the ball here and then just outside of the hip a little bit, but right there along the crest, right there along the top part of the hip, those McDonald's arches. Enjoy that one. That could send a little pain signal down the leg, as well as this piriformis spot can send things down the leg. For you moms with nerve pain or pain in your leg, these two spots could reproduce that pain, and that's a good sign. That means you're going to get rid of it. If we can reproduce it, we can get rid of it. Enjoy deactivating your trigger points and transforming those muscles. Don't forget to take a walk after you do this, moms. Most important part of trigger point therapy is to use those muscles in a healthy way after you've deactivated them. So go for a walk right after these deep tissue practices. Good job, moms. Keep it up.